Hi, I'm Karen and with me is Dr. Jim Rushton. Jim, tell us about dental implants.
Hi Karen. Dental implants were first placed about 50 years ago. They're small titanium screws which we refer to as fixtures, and these are inserted into the jaw bones to act as anchors to replace missing teeth. We can replace single teeth, segments of teeth, or even a whole jaw of teeth.
It sounds interesting. What do you love most about dental implants?
Implants are wonderful because we can create something out of nothing. In the past, where people had lost their teeth, they usually had to resign themselves to wearing dentures. But now, with implants, we can give people their teeth back so that they can talk and eat and smile confidently.
Can you tell us how they work?
Well, implants were discovered by accident by Professor Brandmark back in the early 60s in Sweden, when he was doing research into bone regeneration, and he found that if titanium was left in contact with bone, that the bone would actually fuse to it. And this created a very strong and reliable and biocompatible bond. And now, using this technology, we can insert the implants into the bone, and then these implants can act as anchors to replace the missing teeth, or even to act as anchors to hold dentures in place. Over the last 50 years, implant design and the surface texture of the implants has improved greatly, and so we now have a very, very reliable option to replace people's teeth.
And what are the advantages of having a dental implant over other forms of tooth replacement?
That's a really good question, Karen. As I mentioned earlier, implants provide a very strong and biocompatible bond to the bone. Whereas in the past, teeth could only be replaced with bridges or dentures. Now, bridges involve the irreversible preparation of good teeth, and dentures rely on staying in place by having little clips around the teeth, and these are often quite unstable. Whereas implants can be used as permanent anchors and to replace single teeth, or in combination can replace several teeth, or can be used to anchor dentures into place. So really, they're the most stable and reliable way to replace teeth, to give people back the ability to eat normally, speak normally, and smile confidently.
I'm sure what most people want to know, Jim, is are they expensive?
Yes, that's a good question too, Karen, and we're often asked that question. Yes, they do involve a financial investment, as does anything that's worthwhile. But it's not only a financial investment, it's an investment in time in coming back for active maintenance, as with any other complex restorative work that we do.
And in terms of cost?
Well, in terms of cost, Karen, a single implant is around $5,000, and then a full arch, such as our All-on-4, is upwards of $25,000. But look, really, we need to see you to give you an accurate quote.
So after having the procedure done, how long will they last?
Another very good question. Look, implants should be a lifelong solution, but the restorations on the implants are going to wear out in time. Their life expectancy depends on the anatomy, diet, habits, home care, and maintaining an active maintenance schedule. Porcelain is a brittle material and it can fracture. Denture teeth are made of plastic and over time will wear out. But as a guide, porcelain teeth should last 15 years or more, and the acrylic teeth on the dentures usually 8 to 12 years before they need to be replaced.
Are there any risks involved in having the procedure done, Jim?
Yes, there are always inherent risks with any procedure, but the expertise of the operator will help reduce these. But normally, after an implant's placed, there's a little bit of discomfort for the first 24 hours, but often after 24 hours, people rarely take any painkillers. Sometimes there's a little bit of bruising, sometimes there's a little bit of swelling, but generally speaking, people get over the procedure very, very quickly. Infection is rare. Look, the main complication we find with implants, which is less than 2% of the cases we do, is that we get a failure of the bone to bond to the implant. In this case, we just replace the implant free of charge. Sometimes though, when we're placing an implant, we need to augment the site because there's insufficient bone volume there, or we just need to build the site up to prevent problems happening after the implant's placed, because sometimes, as around natural teeth, you can get recession of the gums, which can expose a little bit of the implant body, but that's rare.
What do you mean by bone grafting?
Well, if there is an adequate bone volume where we want to put the implant, we have to build up that site with the graft material, either prior to doing the implant, or we can often do it at the time that we place the implant. Because when we put the implant in, it has to be in the correct position for functioning and for the final aesthetic outcome.
And lastly, who do you think is suitable for dental implants?
Look, most people are suitable for dental implants as long as their growth is complete. We can't put implants in children, and as long as people are reasonably healthy, then that's not a barrier to put implants in. Look, I've even put implants in a 94-year-old who had a couple of missing teeth and didn't want to wear a denture. So yes, most people are candidates. But look, when you come along to Prime Dental, we'll assess your conditions, we'll determine the quantity and quality of bone that you have, and the suitability for placing implants. But really, come along and see us and we'll work out what's best for you.